All right, good morning, everyone. We made it to Friday. So excited. Not that the weekends are any different than the week, but all right. So most of you are probably familiar with Dr. Kendra Pope, one of my favorite veterinarians in the world, frankly. And she's still sticking it out in New Jersey.
Yes, I am.
Are you from New Jersey?
Yeah, yeah.
Oh, okay.
That's the problem. I grew up here, like it
So did
called
I.
back.
I grew up there, and I thought I would never leave there.
Yeah.
As a child, my dad would change jobs fairly frequently. He was a salesman, so he just kept moving his way up. And so one year we moved to New York. It lasted a year. We bounced back to South Jersey. Then another year we moved to Pennsylvania. Lasted a year, bounced back to South Jersey. Moved to Virginia. Lasted a year, bounced back to South Jersey.
Always found your way back.
I was really happy to leave.
One day, warmer weather, at least half of the year. Yeah.
Yeah, well, yeah. And it was like 15 degrees out this morning, so I didn't get far enough south.
Yeah. No, you didn't.
Yeah, but it's colder where you are. So anyway, so Dr. Kendra Pope, for those of you who do not know her, she has a practice in New Jersey, kind of at the other end of the state from where I was. And it is an integrated practice, but I think you're probably more holistic than traditional. Yeah.
Absolutely. Yep.
Yeah. And just amazing, the work that she's doing. And she's more of a research geek than I am, which I have to tell you, when I was doing research for yesterday, when I was talking about supplements and stuff, I got into some really cool research papers. And I was just like, oh, this is so cool. And I was like, oh, I'm channeling my inner Kendra.
Yes, exactly. I know you can like geek out on it, and it's really exciting. There's good research out there about botanicals and other things.
Yeah. So it was kind of fun. I was like, okay, I see the attraction here. I wouldn't want to do it all the time, but I do see the attraction. So Dr. Pope was kind enough to agree to give up an hour of her morning, because she's very, very, very busy lady, to talk to us about cancer prevention. And I know that we are getting a lot of questions on our Facebook feed throughout the week, with people wanting to know, how do I treat cancer XYZ? My dog has this, my cat has that. We cannot tell you how to treat your specific pet for their specific cancer, because we haven't seen your pet. We don't know your pet. And there is no one size fits all. We can have 3 dogs standing in our clinic that all have osteosarcoma, and they will get 3 different treatment protocols, because particularly using traditional Chinese veterinary medicine, we are looking at pattern differentiation and not just one size fits all. So I'm sorry, we cannot provide that information. You would need to work with a practitioner, and really, and somebody asked me yesterday, after I went through all the different supplements and potential, things that you could add to your treatment protocol. And I got a whole bunch of questions. Well, my dog has this, which ones of these do I use? And it really is something where you would have to sit down and have a discussion about the particular pet, what you've got going on, what your goals are. So it's a little tricky, and I'm sorry, but we can't practice veterinary medicine over Facebook. All right. So Kendra, we talking dogs, we talking cats, we talking everybody?
I think let's talk everybody. And in thinking about this live and what I think would be most important for pet parents to know, there's a couple of things that I would love to just bring up. And, probably people are like, wait, you're an oncologist, you treat cancer. Why are we talking about prevention here? But really, in my opinion, if we're talking about curing cancer, the only cure is prevention, in my opinion. I think that, eventually, conventional medicine will be able to turn cancer into a chronic disease, but to truly reverse it and cure it and make it go completely away and never exist, that's preventing it from happening in the first place. The other thing that I think is really important for pet parents to think about is kind of a springboard off of what you just mentioned. So conventional oncology treatment is tumor centric. 3 patients with osteosarcoma, like you just said, get the same treatment. integrative holistic therapy, 3 patients with osteosarcoma get 3 different treatments, because cancer is not a foreign invader that has attacked the body and is taking over and needs to be cut, burned, and poisoned out of the body. Those are some treatments that we use to treat it, but it's the body's cells which have gone rogue, and along with sometimes needing the cutting, burning, and poisoning, all the time need the metabolic support to try to correct those derangements that were there to begin with and fix all those underlying imbalances. So I think something else that's really important for owners to remember when they're thinking about cancer prevention is it's not something that happens out of nowhere that comes and attacks the body. There's very few, if any, cancers that are related to things like viruses and infections. And the other thing that was wildly eye-opening to me when I realized it was that in people, we don't have the same stats in animals, but I would imagine it would be very similar. In people, depending on the research paper that you look at, anywhere between 70 to 90% of cancers are preventable with lifestyle choices. So in humans, that would be things like smoking, alcohol consumption, obesity, dietary choices, sun exposure. So if only 5 to 10% of cancers are completely genetically driven, then that means the majority of cancer can be prevented by lifestyle choices.
Yep.
Now, for animals, I do think that genetics and breeding specifically probably play a much larger role than it does in people, because there's so much what's called line breeding.
Right. Well, particularly if we look at Bernese mountain dogs, I mean, those are a good example.
All the predisposed breeds, Bernese and flatcoats and Goldens and Labs and Boxers. We know time and time and time again, they come to us with cancers. And then there's other breeds that don't get it as often. So I think that what people need to understand is that there's so much we can do, especially on the holistic side with the metabolic supplement, terrain of the body to keep it healthy, to prevent that from happening. And that's really powerful.
Yep, exactly.
Mm-hmm.
So let's talk about, some of the things like the very basics, the most important. I mean, we all know that I talk about food all the time, so I'm going to start there. I think that what we put, crap in, crap out, and putting a clean diet in is really paramount to being the basis of anything else that we build on top of that.
Absolutely. Yeah. And that's what I always say to people. If there's only one thing that you can ever do, it's feed real food. Now, optimal nutrition might be very different from just a real food diet, because unfortunately and very sadly, the majority of the food that's readily available to most people is not very nutritious, meaning that the animals that are supposed to be providing certain things for us are also heavily carbohydrate fed, pesticides, antibiotics, contaminated. The fruits and vegetables we eat, GMOs, pesticides, grown in soil that's been so depleted because of turnover of crops to have more food readily available, that apple that's supposed to have however many milligrams of vitamin C doesn't, because it can't get it from the ground anymore, from the tree it grows from. So I think very unfortunately, even when people are trying to do their best to feed a healthy diet, the ingredients in the food that they have access to may not have the same nutrition that they want it to. So it does come down to, people always say, oh, like, are you a vegetarian? Are you a pescatarian? I always say everyone should be a qualitarian. You do
I like that.
Yeah, you do the best you can to get the highest quality products. And oftentimes that means you have to shift, especially in times of COVID where, supply chains are so messed up. Maybe sometimes that means you're eating wild caught fish. Maybe other times that means you're eating pasture raised beef. Maybe other times it's pasture raised poultry. So I think it's about working with farms and farmers markets and CSAs to try to get the highest quality food possible at any time.
Yeah, exactly. And that can be very difficult for people. I know we've been really proactive about that since we moved to North Carolina. Our freezer is filled with pasture raised beef. We actually found a farm where the wife is a veterinarian. She's not.
Oh my gosh, awesome. How cool.
But they are really proactive about raising their cattle in a really healthy way and what they're fed, because you have to look at what the animal that you're eating, what they ate.
Absolutely.
So that was a great find, but we did the same thing with our pork and with our poultry. And we happen to be in an area where within an hour's drive, we can find these farms that are raising the animals the way that we want. And then we had our own garden, which our soil is so depleted. The land that we bought was a hay farm, and hadn't had anything added back into the soil for a long time. So building up the soil in the garden is one of our huge goals for the next year or two. But when you grow your own and you start with organic seeds and you're not using pesticides and everything is done organically, it makes a huge difference. And we got a freezer full of vegetables for the winter, which is awesome. Not everybody can do that. If you live in an apartment, if you're lucky, you'll have a pot of tomatoes on your patio. So I get that it can be very difficult, but again, it's the best you can do with the resources that you have available and the finances that you have available. I will tell you, it is definitely cheaper to grow your own veggies.
Yeah, absolutely. And I've come across a couple of websites that I think are important, because I think people automatically think, oh, and I hear this from my brothers all the time. Oh, it's too expensive. I can't eat organic. There are absolutely things that you can do to access organic, pasture raised, et cetera, more affordably. So all the things that you mentioned obviously are awesome choices. There's a website called eatwild.com and consciouscarnivore.com. And they show you can put in your zip code and they show you all the local farms that will provide the meat, the dairy products, all that, the cheeses, all the animal byproducts. And frankly, if you're going to local farms, you're usually going to be paying less than you would be at any of the grocery stores.
Yes.
The other CSAs are always very good. The community share agriculture in your area, and most places have that. The other websites that are good is one is called Misfits Market or Misfit Market. It's all like the ugly produce, like imperfections. There's nothing wrong with the food. It just looks bad. And so the grocery stores won't take it. So they sell it for significantly reduced costs. And there's a couple of those like that. So it's not impossible. And you can't assume that if you're limited in finances, which, almost all Americans are, that you can't afford it, because there are ways around it. So there's definitely things to check out. And I like those 3 websites.
Yeah, those are awesome. Thank you. Yeah, we ended up buying half a cow. And so my husband's a Texan, loves a big, huge steak. And that's like his favorite meal in the world. He would eat it 3 times a day, I think, if I let him. But, steak in the grocery store now for a high quality steak is running $35 to $40 a pound.
Oh,
and I finally had to draw the line and say, no, we are not spending $40 a pound for you to have a steak for dinner, because we'll go through 2 pounds of steak for dinner with no problem. When we got our cow, we did get a lot of ground meat, but we got a ton of steaks and filet mignon and ribeyes. It averaged out $7 a pound. So I'm eating steak. And if I say that my steaks are worth $35 a pound, that means my hamburger was dirt cheap. Yeah. So, not everybody has freezer space. We had to buy a freezer, which they're hard to find right now, specifically for our cow. But we've got enough beef now for at least a year. And it's high quality grass fed at $7 a pound, and when we ordered it basically for free, if you want it, you can get the heart, the kidney,
That's
the
what I was
liver, the
just going
lung.
to say.
Yeah,
And you
so
can
they'll,
get all that, which
yep.
they
So
think
they'll
is
throw it
great.
in if you want it, and if you don't want it, then it goes elsewhere. I was like, oh no,
Exactly.
give me some stuff.
Absolutely, because then you get the organ meats that have all the vitamins and minerals that they're so dense
Yep.
in, which we don't get from eating muscle meat. And then you get the bones, which you can make all the bone broth from,
Yep.
which is so important.
Exactly. So
Yeah.
yeah, so that was great, and we could have bought a quarter cow. It just depends how much freezer space you have. This particular farm, you can even go and just buy smaller lots as well. And we have another one that's 20 minutes in the other direction. Same thing. You can just show up at their farm, and they have a freezer there, and you can buy your bags of stuff.
Yeah,
so
that's how I do mine, because I have an apartment and it's just me. And so that's what I do. I go to the farm and I will get the different animals, you know, I have liver, the bones, and then the muscle.
Yep. Yeah. Perfect. Okay. So food is our foundation. We're going to start there. We're going to feed as healthy as we can.
Yep.
So, what things are we avoiding in order to keep our pets healthier?
So, I think the primary one that if we have a choice from a young age is that we're eliminating carbohydrates from the diet, because they have no nutritional need for them. It's animals that have to restrict fat or protein that then have to have carbohydrates added to their diet to reduce the percentages of protein and fat. The carbohydrates, as all of us know as humans, if we eat too many carbs, it happens to us. They just convert to glucose and they affect your glycemic control. If they're not utilized for energy, they're just stored as fat. And so limiting our carbohydrates as much as possible, for sure. The others that are linked in people to higher incidences of cancer are fried food. Generally, we're not feeding fried food to animals. Red meat is linked to cancer. However, in the literature, I have never found a paper, they could exist, I might just never have been able to find it, that separates out pasture-raised organic beef from corn-fed factory farmed beef.
Right.
Probably all the links to red meat is likely related to the amount of omega-6 fatty acids and how pro-inflammatory that food is.
Yep.
Because that's the same thing that happens with fried food. It's all pro-inflammatory. So red meat, more than a pound a week, is linked to increased risks of prostate, colon, breast cancer in people. However, question mark about the quality of the red meat. Let's see, what else are we avoiding? We talked about the trans fats. So that's the other one that is a huge problem for humans. Fried food, red meat, trans fats. And really, when it comes to what we're avoiding is overfeeding. So the only one thing that's linked to longevity in dogs, there's more in people, is them being in that longevity study, is them being underweight. And Judy, you probably have come across this in your Chinese medicine theories. It was very interesting because I was doing a presentation with a board certified nutritionist, and we were talking about nutrition in cancer patients. And she was talking about the study where feeding about 75% of what their nutritional requirement would be, so they were just underweight, was linked to longevity. And then I, about 2 minutes later, presented a traditional Chinese medicine theory about where you only eat until you're 3/4 full, and that was linked to longevity of life. So it was actually very interesting because they coincided with one another. And so it's actually about not overfeeding and keeping them lean. So it's not just what you're feeding, but that you're not feeding too much of it.
True. So going on that vein of keeping their weight very moderate and not allowing them to be overweight or obese, which is, let me tell you, that is an epidemic in this country for people as well as animals.
Yep.
I think the last stats I saw said something like 54% of dogs and cats in America are overweight. It's probably more.
There's no way it's only 54%.
Yeah, it's probably more. I mean, I guess if we're saying, overweight versus obese, because I think what most of us consider a healthy weight is actually overweight.
Yes.
so that's part of the problem. We don't have a good handle on what a healthy weight is when we are looking at our pets. Like I look at my cats, I've got one that is on the very thin side. She'll probably live forever and she's a pain in my butt. Then I've got one who's a pretty normal cat. And then I've got one, he's Blubber Boy, and he's the first one to the food. In our cat condo, they've got this little 8-inch hole to get through. And every day I'm like, is your belly going to fit through there? But, you know, he's the first one to the food bowl and he eats more than everybody else. And that's just the way it is. Okay. I would have to restrict him somehow. And I'm not quite sure how to do that with multiple kitties. But so definitely keeping them lean, but that also is going to include getting them moving, keeping them moving. Yes. You know, and I think that's something, especially with those of us who are working all the time, sitting at our computer all day. It's bad for us to sit all day. I saw something the other day where you should set a timer every 30 minutes to go off every 30 minutes, get up from your computer, go walk through the building, walk outside. And frankly, if we would do that for ourselves and take our pets with us every time we did it, it would be healthy for both of us.
Absolutely. And, you know, there's so many theories and support about cancer being metabolic mitochondrial disease, not a genetic disease. And what the mitochondria needs to be healthy is oxygen. And the only way that you get oxygen to the mitochondria is with exercising. There are things like ozone that also does that, you know, so medical ozone may play a part in some cancer prevention, but that's because it would be keeping mitochondria healthy. So absolutely 1,000% activity is for sure in people linked to cancer prevention and decreased risk of cancer and cardiovascular disease. Yeah, for sure.
Absolutely. Yeah. So, and particularly if you have, I talked a lot this week about stress and chi stagnation and blood stagnation. So movement helps with all of that. And certainly for those breeds of dogs that are supposed to be working dogs, and frankly, our cats too, it's the nature of cats to hunt. To be on the hunt, to be stalking, to be prowling. I watch our barn cats who are just picture of activity. They're always, you know, playing with strings or hay nets or pieces of hay or chasing mice. And it's like they're just busy versus the indoor cats who are like, oh, here's my cat tree. Oh, here's the sofa. I mean, that's literally, they move from the sofa to the chair to the sunny spot.
Yeah. Absolutely. No. And if you think about, you know, for us as people in our lifetime right now, the thought of what it was like 100 years ago before the Industrial Revolution and refrigerated cars that could move meat, and then the change of the pet food industry completely for them to be getting these commercial available products, it really hasn't been that long from a, you know, evolution standpoint. It's only been like 100 years. And so if you think about the evolution of cats and the evolution of dogs, their body and their genes, just like us, have not had time to adapt to how much has changed in 100 years. And so their bodies are not used to exactly what you're saying, sitting around all the time, sedentary lifestyles, obesity, high carb diets, high processed diets, lack of sunshine, lack of clean air, food that's reduced all its nutrients, not providing us what we need. So there's unfortunately like an assault on all of us, which I think is no shock about why there's been skyrocketing amounts of chronic disease and cancer on both humans and animals.
Have you seen any studies that would show, and maybe we don't have good statistics from 100 years ago, but I would be really interested to know, like, what was the percentage of dogs or cats that were diagnosed with cancer in their lifetime or died? Because we have pretty good statistics now, and they're shockingly scary statistics that over half of dogs over age 10 will die from cancer. That's horrible.
And that study is like 20 years old, Judy. It's so old. It's so old.
It's probably much worse now, but it would be really interesting to see statistics like every decade, you know, going back to kind of before the Industrial Revolution, like every decade, this is our, and 100 years ago, we weren't so worried about, we were, fighting world wars. We weren't really so concerned about what the statistics for cancer were in our pets. And I think veterinary medicine was kind of, very minimal. Particularly, it was more farm animal and a lot less on the pet side, but it would be really interesting to
I completely agree. And the other resource that would be really interesting that I haven't come across, but I'll keep an eye out for it if I ever see it. A lot of the European countries haven't industrialized as much. There's still a lot of traditional cultures that still have their own farms and go to farmers markets, and it's not as industrialized as it is here. And a lot of them keep their animals the same way. And I wonder too if I could ever come across data about that, but I haven't seen any. And it has to be significantly impacting all of it.
Yeah, I agree. So let's talk about some of the other things that I think are significantly impacting. I don't know which one to go to first, but I'm going to go to vaccines.
Perfect. Love
it. So because you're the data person, and the pharmaceutical companies certainly want us to believe that vaccines are the best thing since sliced bread, which sliced bread is not a good invention either.
Exactly. That's also a bad invention.
So okay, it's in the same category as sliced bread, but do we? I mean, I know that certainly for our cats, actually dogs too, they like to make sarcoma or fibrosarcomas and tumors at injection sites. I mean, I can't tell you how many 10 to 15 pound tumors I've seen on dogs from vaccines. And I mean, kitty cats don't develop 15-pound tumors, but they develop really ugly tumors that kill them.
Yeah. No, I mean, the fact that we have a specific cancer that's just related to injections, like, are you serious? Like, the cancer is just from injections. So Jean Dodds obviously has, a lot of research that she's done about this. Most pet parents, I'm sure they're completely aware of this, but obviously pharmaceutical studies and vaccine companies are not funding trials to assess the immune response of vaccines longer than 3 years to determine if they actually work. Very likely, these vaccines last much longer than the amount of time than they're labeled for. And if you ask any holistic veterinarian, which I'm sure you guys have all heard Dr. Judy talk about, if we do titers, which is the blood antibody level testing, many of these animals have sufficient titers for many, many years, potentially their entire lifetime. I heard Jean Dodds speak once at a conference, and she was talking about the publicly funded trial that she had with a rabies vaccine, where she found 80% of dogs have one rabies vaccine that will last on average 8 years with one rabies vaccine. So that means probably 80% of dogs need 2 rabies vaccine in their lifetime.
Yeah, which unfortunately, because we have laws around the rabies vaccine, I get it. I understand it. You don't want that one breakthrough case, but it makes it very difficult for pet parents. Let's talk, and this is a little controversial too. So we talk about doing titers, and we don't have a way to measure memory cells. We don't have, that titer doesn't tell us what the body might do if it was exposed to something that it had seen in the past. So I'm sure you do a ton of titers in your office. We did a ton of titers in our office. I used to titer my dogs every year. I don't now. They don't even see anybody. They go in my backyard. So there's 2 schools of thought. One is if they ever had a positive titer, that means their body recognizes it. They have protection. Doesn't matter what their titer says from here on out. Versus, no, we have to have that measurable antibody titer in order for them to be protected. Which side of the fence do you fall on?
I fall on the conservative side, mostly because I try to toe that line with my conventional community and trying to give them something that they can at least not lose their minds about. I am comfortable landing there because I would say 95% of the time, they always titer above a certain level. And so they're considered sufficient. When my patients titer below that level that's set by, we send ours to Kansas State University. When they titer below that level, we have a conversation. and we say, what disease are you titering below the level for? Where is this disease carried, and what's the risk exposure? And do we even want to do it or not? Because there is a possibility that there still is sufficient immunity because we can't measure it. So absolutely, the way that I practice is with the quantitative titers, but I always have an individualized conversation if they ever fall below it. And I would say that unless it's a case with like a rabies vaccine where we need an exemption letter, a lot of times we choose not to rebooster them because we believe there's probably still immunity there.
Yeah. Yeah, that's pretty much where we fell. I would have a conversation with anybody whose titers, pet's titers came back low. Well, where does your pet go? What does your pet do? Do we just need this because we need proof to get into boarding, grooming, daycare?
Yeah.
In which case we may have to give a booster so that we have proof so that you can get into boarding, grooming, daycare. How important is it that you board your pet? Can you find somebody to pet sit at home? But I think I think it's imperative that we vaccinate these animals less than what the traditional veterinary community wants us to do.
Absolutely. And I think that the other thing I always talk to owners about in my cancer prevention, consults and appointments that we do is about over vaccinating is one thing and the repercussions to the immune system. But part of the concern with over vaccinating is all the adjuvant and what's in the vaccine other than, the modified virus or the live virus that's in there. And a lot of times those are things like aluminum and heavy metals and other things that are neurotoxins, can get deposited in the body over time. And so I also always talk to owners about doing additional support to the organs of detoxification and using natural products that help with heavy metal detoxification, which are usually the blue-green algae like spirulina and chlorella. So doing that a lot around the time of vaccines to try to mitigate and minimize that extra junk that we don't want in there.
Exactly. Mm-hmm. So now that you opened that up, let's talk about your favorite things that you will use as support for the detoxifying organs.
Yes.
And what you use as detoxifiers and how often you would do them. Is it just around vaccines, or do you like your patients to go through some sort of a detox a few times a year? Like, where do you fall on that?
There's a couple of different things that I think are important about detoxification, because when you hear detox, you think of like colonics or like enemas or like juices or these protocols. And those are all aspects of it. But I think when we're talking about and thinking about detoxification, I like to even take the lens back a little bit further and think about what we can do to try to even minimize the toxins getting in the first place. And the two most obvious, most least thought about places are the water and the air. And so, and the great thing about all of this is you doing this for your pet is going to do it for you too. And that's really important. So the air we breathe, completely polluted, lots of junk in it, in our homes, from our kitchens, from industrialization, from ozone, all kinds of stuff, lots of junk in the air. So instituting high quality air purifiers in your home, making sure that you're having your windows open whenever you can stand it, reducing kitchen emissions with like the charcoal screens and exhaust, controlling the purity of the air in your home, especially because your pet spends so much time, especially some of them are exclusively indoors, is very important. And then making sure that the water is filtered, because our water is loaded with all kinds of nasty things, fluorides and plastics and birth control and runoff from pharmaceuticals and just junk. Even if you have an older home, there could be copper and heavy metals from your pipes. So making sure you have a really high quality water filter, that usually you want something that's going to have a charcoal filter as well as a fluoride filter. No plastic, because it's going to be leaching the microplastics. So those two things are like the first step to detoxing, because you want to eliminate what you can that the body has to deal with. Then when we're talking about what detox protocols to do, there's a couple of different things that you can do to help enhance detoxification. And what that means usually is helping the liver to stimulate its normal function. Along with the liver, the other organs of detoxification are the bowel, obviously, the lymphatics, the kidneys, And then not as much in dogs and cats, but a little bit. And in people, the skin. So there are definitely herbs and herbal protocols that can be enhanced. And I can mention some of those to everybody. But the other things that can be done to try to enhance those organs of detoxification are different types of minor stresses on the body. They're called hormetic stressors. They're like the good stress, not the bad stress. And so even something like fasting can be really important for that. And fasting goes back to what we were saying about keeping us lean, reducing caloric intake at intermittent intervals. And that doesn't mean that you and your pet have to go for weeks without eating, or especially if it's a cat or a diabetic animal, but it's reducing the calories significantly to a very small amount. So you could be drinking clear broth during that time, bone broth during that time. And doing it at least quarterly with the season changes is usually what you should shoot for. Because it's usually around the season changes when, I'm sure most people know, that's when your allergies get worse and, coughing or sneezing or whatever. So for other than things like fasting, other than protecting yourself from the most common toxins in the air and the water, then the herbs and the supplements that you can think about for helping, and the ones that I feel like I reach for all the time. And again, just like Dr. Judy said, it's always individualized because there could be variations on this. But glutathione is a really important one for the liver, super important. Vitamin C goes hand in hand with glutathione. They work together in the pathway in the liver. Milk thistle is another one. It's just a general antioxidant of the liver. It's very important and helpful. And then the other herbs that you'll hear about a lot that are important both for the GI tract for detox as well as for stimulating the liver is there herbs that have high concentrations of what are called berberines. So things like Oregon grapefruit, they're usually very bitter. And so these bitter herbs are very good for stimulating the liver function. And once you do that, once you stimulate all that detox and all that junk coming out that's stored in the fat and the connective tissues, you want the body to get rid of it. So herbs that are going to enhance, they have mild diuretic function. The one that I like the best for that is nettle. So nettle leaf, nettle root, herbs that are going to stimulate the functions of the lymphatic system. So some that are really good for that are things like red clover and cleavers, things that stimulate the bowel detoxification. So we know probiotics are going to do that. We know fiber is going to do that. There's some herbs, one in particular called triphala, which is really good at helping detoxification of the bowel. It's a traditional Ayurvedic herb that is used for colon cancer prevention. And so getting all that stuff stimulated, so limiting the stuff in, getting all that stuff stimulated 4 times a year, and then getting it all out. And I think doing it quarterly is very reasonable and, an otherwise healthy animal. With my cancer patients, they're getting it all the time.
Well, yeah, because we're trying to get all that toxic crap out of there.
Because it's all built up and now causing us a problem.
Perfect. So let's talk. Let's talk other chemicals, particularly chemical prevention, flea, tick, heartworm. I'm so against all these chemicals. Do you use? You're in Central North Jersey-ish. Do you recommend heartworm preventative in your practice?
We have a conversation, and I find that pet parents have different levels of risk they're willing to take. Fortunately, between the months of like October and March, we don't even have to worry about it. So I absolutely positively tell them not to give it then. In the summertime, we talk about it. A lot of these essential oil-based products, if owners are willing to be very diligent about putting them on them consistently, like they would when they go outside, work really well.
Yeah.
It's a lot of times what it always comes back to is owners wanting the convenience, right?
Sure.
That's when we get
convenience and risk tolerance, because I have people who live in areas where it's like, you live in the frozen tundra and their risk tolerance is not there. And they absolutely, even in New Jersey, I had clients who said, no, I'm going to give it all year round. I want zero risk. And it kind of breaks my heart a little bit when when I can't kind of break through that, but I understand it. Everybody has their own level of accepting, some people want zero risk, and it's sort of like investing. Some people are like, go for it. And other people are like, yeah, no. Like,
exactly.
Give me something where I'm not going to lose a penny.
Yeah, no, it's true.
So, all right. So what haven't we covered? We've talked about detoxifying, certainly, clean air and water. So you talked about ozone and you're adding that in, which is very cool. Where do you fall on the hair analysis testing? Do you think that's valid? And does it help? Does it help us figure out, what kind of things our animals are being exposed to?
Yeah, I recently I reached out to the woman that does a lot of the training so that I could learn more about the specific animal test. And the human side, and me myself as a patient, have had hair mineral analysis done, and it's definitely part of a functional medicine workup. There's still controversy in the human community because I think that the criticism is we don't know how good the tests are. Hair is definitely the best way to test for heavy metals. So that's the best diagnostic tool. I think that, like a lot of these other tests, which probably we can talk about next, Judy, is like the new Q2 test and
I definitely want to talk to you about those.
Yeah, all those, cancer screening, blood diagnostics. I think the hair mineral analysis, like those tests, is another piece of information that shouldn't be taken as, gospel, but should be used as a data point to put things together. Because when it comes to cancer and trying to cure it, you have to get to the root cause. And a lot of times that root cause is not going to, show up on a test and be like, here I am, I did it, it's my fault. It's going to be a bunch of little things that you put together and you're like, wow, this animal lives in a, suburban area where there's a lot of air pollution, lives inside most of the time, sedentary. Mineral analysis is pretty bad. I think there's a lot of, heavy metals here, been over vaccinated. It's about really being a detective and trying to put all those pieces of information together and see what you think is most likely. So I think that if we get a hair mineral analysis back and it's like off the charts, there's nothing wrong with us instituting these detoxification, the herbal word is called alternative formulas, that help to try to lower that, because it can only help the function of the body. So I think they're worth considering. But I think, like a lot of these, you can't take them as, gospel.
Yeah. Mm-hmm. Yeah. I feel that way with a lot of the allergy testing that's done. And even in practice, when we would do allergy testing, it was, okay, we're going to take this with a grain of salt and we're going to, try this out and see. I mean, if you get something that's really off the scale, you probably want to avoid that if you can. But things that are sort of in that gray zone, or maybe not, you always have to take that stuff with a grain of salt. And there are some things you can, like, you get a test result and you can do something about it. There are others, you get the test result, and it's like, I can't do anything about that anyway.
Yeah.
So I talked on Tuesday about diagnostics and the screening tests from VDI Labs, their TK1 and their C-reactive protein. Yep. Talked about the new Q. How are you using those, and are you incorporating them in like annual, semi-annual screening tests? Do you only use them when you suspect there's a cancer? How are you incorporating those into your practice?
So the VDI panel I use all the time, because for the vitamin D and the C-reactive protein, because those two are like non-negotiable for my cancer patients. I want to know both of them because, just like you said, there's interventions I can do about both of them. Also, when we talk about a metabolic approach to cancer and kind of the there's like 5 main parameters that they always look at for people. Vitamin D and C reactive protein are 2 of them. The other one is what's called a neutrophil to lymphocyte ratio, which is 2 white blood cells, and how they're related at the time of diagnosis. It speaks to inflammation. Something called lactate dehydrogenase, which is a marker that's found on serum chemistry, also related to inflammation in the body. And then first morning urine pH, related to acid-base status. So these are like my non-negotiables that I want for all of my cancer patients. The TK1 has the most research in lymphoma. So if I'm treating a lymphoma patient, I will use that kind of like a biomarker, because what we don't have in veterinary medicine, which the functional medicine naturopathic oncologists have on the human side, which is very, disappointing, they have extensive cancer biomarkers. So a cancer patient, even if they're undetectable cancer or a very small cancer, will be shedding and excreting and circulating tumor cells throughout their body at magnitudes higher than the number of cancer cells in the tumor that started. And those circulating cancer cells can be detected, quantified, identified to help practitioners who are instituting conventional or integrative protocols that it's working and they're coming down. It also is nice because then when a patient starts to relapse, even before it can be detected on x-rays, these cancer markers are going to start going back up. In veterinary medicine, we got nada. So we have nothing to use like that. So the TK1 kind of walks that line for lymphoma patients. And I've seen, before I could palpate that the lymph nodes were getting bigger, it start to come back up. And I'll be like, I'm sorry to tell you this, but I think we're going into bad territory. And I'm usually right. And then the other test that kind of walks that territory or claims to walk that territory is the new Q2 test. So it's trying to identify diagnostics that close to the time of relapse or diagnosis, we're going to have overt abnormalities. It shouldn't be used as, let's do this diagnostic twice a year and then we're clear and we don't have to worry about it. I think that, like everything else, it should be taken with the complete picture. We're not forgetting about our nutritious food and our detoxification protocols and our minimizing vaccines and, our spay neuter practices and all that kind of stuff. So, but I do think that especially if you have abnormalities, they're helpful because then you can be like, uh-oh, something's off here. Let's try to institute something to bring that down.
Absolutely.
So I'd say at least yearly. If a patient has a chronic disease or any other ailment, I would say twice a year.
Right. Okay.
And in my patients, we're doing it every 2 to 3 months to see.
In my practice, we were, I wanted labs every 3 months, particularly if we were dealing with chronic disease or chronic medications. And that it's hard. And now that I'm on the other side of the fence and I have to find a veterinarian to do these things for my animals, it's a little tricky. And I get where people are, it gets expensive. Yeah. And we don't have holistic practitioners down here. So
are the holistic practitioner that's down there.
I know, and I don't have a license.
Yeah. You're like, but I'm not.
So I may have to change that just so I can treat my own animals. Yeah. It's a little tricky. Okay, what have we not covered that we want?
I think the only other thing that I routinely talk to owners about with cancer prevention is when they spay and neuter. Was that something?
Oh, yeah, that's where I wanted to go next. Thank you.
Yeah. Mm-hmm. Yeah. So again, I like to point out to pet parents so that they can make informed decisions. There's very little research going on. I apologize. My dog wants to join the conversation. There's very little research going on about delayed spay and neuter practices, and not necessarily for bad reasons. We obviously have a significant pet overpopulation issue. And so, the veterinary community doesn't want to go about worsening that. But in the informed, educated owner that's trying to make the best decision, there are reasons to consider delaying that. And in what I've seen as far as research is concerned, is that it seems to all be related to luteinizing hormone, a generally considered sex hormone that is produced by the reproductive organs, but there's receptors for this all over the body, in every tissue of the body. And that's what's very interesting, is that if it was just important for sexual reproduction, then why would it be found in the GI tract and in the eyes and in the heart and everywhere else? So likely us removing the organs that produce LH early is having long-term consequences. And there are starting to be early trials that show in certain breeds of dogs, Rottweilers are one, flat coat retrievers are another, Bernese Mountain Dogs, delaying their spaying and neutering does decrease the risk of things like osteosarcoma and hemangioma.
Exactly. Interestingly, I was doing a bunch of research for a thing I was writing about Cushing's disease, and the luteinizing hormone came up as a huge factor with that. And a lot of it was related to studies done in ferrets. So,
wow.
So I did some research reading it, and it was very cool.
I feel like Cushing's disease is rampant.
Oh, it is.
Everybody has Cushing's disease.
It is. And that's what I was going to write a book specifically about Cushing's disease, like causes and things that go into it. And I have the bulk of the book is done. I should give it to you to finish because the bulk of the book, as far as causes and things that go into it, that part's done. I hit the treatment part, and then, got on another project. And, it is what it is. But yeah, so we have some studies in dogs, particularly the bigger breeds of dogs, that show that delaying or leaving them intact is probably a better way to go. Like my males, for my clients who were responsible, I was just like, why don't you just leave them intact unless you're having an issue with them? For the females, we kind of would try to find that middle ground somewhere. Like, we don't want to risk having a PIO when they're 10 or 11 or 12 years old. So, we'd kind of find a middle ground usually. And so for the girls, a lot of times we were getting them spayed between 2 and 5 years of age. I don't know where that magic number, I don't think anybody knows that magic number. And certainly leaving them intact for a lifetime is an option.
Yep.
It just depends on your lifestyle, what you want to deal with. And then let's talk cats, because I think cats are a totally different ballgame from our dogs.
I know. Especially because having intact cats is like almost impossible for most pet parents, and
the boys stink and spray.
Exactly. And the girls go crazy around their cycles.
And I will say mammary cancer in kitty cats is very, very aggressive. And the only mammary cancers I ever saw in practice were cats who were not spayed or who were spayed very late. Mm-hmm. So I think it's a totally different, they're not small dogs. They're a totally different deal. But I do also feel that allowing our kitty cats to reach full maturity, finish growing before we spay and neuter is very important for them, just like it is for our dogs, probably for different reasons. But I think they need to reach that sexual maturity. I understand why shelters and rescue organizations insist on having them spayed and neutered before they send them out into the public. But I think it's doing a huge disservice to these animals by doing these early spay neuter procedures. And I don't know about you,
like 6 months, it's like 6 weeks when they spay.
I know, 6 to 8 weeks. I mean, we used to do the shelter spays and neuters, and they would bring us these litters of kittens, and our rule was they had to be 2 pounds before we would do them. So that's usually 8 weeks. But one of the things that was frustrating for me in practice is I would have clients who wanted to rescue or adopt a new pet, and as soon as the rescue heard that their dog was not spayed or neutered and was more than 6 months old, they were like, oh no, we can't, you're an irresponsible pet owner. No, actually, this is a very responsible pet owner. And so we had to go to bat for them so many times. And, the owners who didn't vaccinate every year because they were doing the right thing or doing titers, the shelters and rescue organizations would just go ballistic. What do you mean you don't have your dog on heartworm preventative year round? You can't have one of our dogs. So do you fight that battle for clients as well?
Yeah. And what also unfortunately happens is, a lot of that is the reason that people then go to breeders.
Yeah.
Because exactly, they are trying to do the right thing. And then because the culture is what it is, and there's no room for these types of owners that are doing the right thing. Then I find that they often will go to breeders, to get an animal.
But even finding a breeder who is not going to start vaccinating at 6 weeks old, isn't going to start throwing deworming chemicals at them at 4 weeks old, it can be very difficult. So the same questions have to be asked if you decide that, you know, the rescue organizations are being too difficult for you to get the animal that you want, and you decide to go to a breeder, ask the same questions. Like, you know, I don't want a puppy or kitten that got vaccines at 6, 8, 10, 12, 14, and 16 weeks. That we're setting them up for failure from day one. I don't want to see deworming medication going into them at 2, 4, 6, 8, 10 weeks. And I think
prior to that with mom, what's she eating? Because
exactly.
Mom's microbiome is the first thing that colonizes baby's microbiome. And so if her gut is, you know, all inflamed and leaky and carb rich from her highly processed kibble-based diet, that's what her baby's microbiome is going to be. So yeah, absolutely. You know, people bring puppies and they're like, we want to start from the beginning. I would argue that exactly what you're saying, to start from the beginning is researching where you're going to get that pet from. Yeah. So that you know that they're set up for success.
Exactly. And
Yeah.
that's another whole webinar on you know, what we should be doing with the breeding parent animals. And I'm not a breeder. I've never been a breeder. I don't work with a lot of breeders because reproduction in neonatology is not my gig. But I think it's really important that education for the breeders who want to do things right, that we start a different conversation. And unfortunately, I think most of the reproduction specialists in the veterinary field are very traditional. So they're having a totally different conversation. And I think that's a bit of a problem, but we'll get there.
Yeah, no, absolutely. Yeah, absolutely.
All right. Well, we're at the end of an hour.
That went fast.
It did. Kendra, you are just amazing to talk to always. So we're going to be mean, and we're going to get our little hook and put it around Kendra's neck and keep hooking her back in to talk to us and give us her vast knowledge, because it is just amazing. Kendra, stay warm. I don't know what kind of snow you're getting this. We're supposed to get snow, which really stinks because I don't know what to do with it down here, which means nobody knows.
Yeah, I know. It's fine. You can still like function. Down there you can't. Everyone's like, snow.
I know, a 1/4 inch of snow, and they're all like, but the schools are closed today. It's not even snowing.
Oh my gosh. Yeah, no.
I know. It's crazy. All right, everybody have a wonderful day, a wonderful weekend. If you didn't get a chance to sign up for our newsletters, you need to do that, or at least go to drjudymorgan.com, read the cancer blog that we made live yesterday, because it has a lot of the information and links to the testing, supplements, all kinds of things that are in there. And, you know, as I learn more, I update the blogs. So, you know, we'll get more. As a matter of fact, I don't think that blog has anything in there about prevention. So we may have to add another section on that, which, oh, Lord, more work.
Yeah, always something.
Always something. All right, everybody have a wonderful day. We're going to let Kendra get back to work, or whatever it is she's doing today. Maybe she's going to take a couple hours off. That would be amazing.
No, that's not true.
I get to babysit, so I'm going to play with a toddler.
Yeah, I love it. Perfect.
Everybody have a wonderful day.